This question was recently asked by several different US-based nail techs, so I thought I should address this once again. My friend is a nurse and was told she can no longer wear enhancements or any type of resin-based product. Why regular nail polish and no gel polish? Sadly, many hospitals are on the wrong course. First, nail polish also uses resins, which are also known as polymers. Second, many hospitals have adopted similar foolish practices. I've tried and not been able to get very many of them to see a more reasonable approach. This all started when the Center for Disease Control, also known as the CDC, issued guidelines for how to safely wear such products. The CDC warned against improperly maintained nail polish and other nail coatings. They were concerned that when not properly maintained, these coatings can promote the transfer of infectious organisms. Why? Well, because bacteria can grow inside cracks in areas where the coating is lifted. The CDC asked hospitals to pay attention to this and ensure that coatings are properly maintained. However, most hospital administrators are men who care nothing about nail coatings. So many hospitals decided it was easier just to ban nail coatings rather than to manage the problem. Some hospitals tried to ban all nail coatings, even nail polish, but there was a huge backlash from nurses. So many other hospitals just took the easy way out and allowed nail polish only. However, it makes little to no sense to prohibit some types of nail coatings while allowing others, and it shows a complete lack of understanding on the part of hospital administrators. Interestingly, the same CDC report said that a doctor's necktie is the most contaminated item to come into a patient's room. Yet, I don't see any hospitals telling doctors they can't wear neckties. I wonder why. In my view, this is all just hypocrisy. Most hospitals have serious problems controlling the spread of infection. It's been more than 15 years since the CDC made these recommendations about nail coatings. Have banning artificial nail coatings made any difference? No. Still, each year, 2 million people in the United States alone get infections while visiting a hospital, and 90,000 die as a result of hospital-acquired infections. Banning nail coatings was a useless gesture that did nothing to address this growing problem. I was told by hospitals that this was I told hospitals that this was a useless gesture when the issue started. And unfortunately, history has proven me correct. Hospitals should get real with these policies and stop chasing their tail. Here's the real problem. Hospital workers don't properly wash their hands, and doctors are the worst. Studies by the CDC show that only about 40% of hospital workers adhere to proper hand washing procedures. If a doctor even washes their hand between patients, which does not often occur, according to the CDC study, if a doctor does wash their hands, they spend less than 5 seconds doing so, and nurses spend about 8 seconds, rather than the 20 seconds required to do a good job. Therein lies the bulk of the problem, and hospitals don't seem to be able to control this, so more people will continue to die needlessly and not because of gel polish. That's just a smokescreen to hide the real problem.